interview. Now, the country in the last few days has seen a sharp increase in the number of COVID-19 cases and deaths. This calls for concern. This calls for every one of us to get involved and do our best to reduce these numbers. This evening, we discuss the COVID-19 situation or status update for the country Zambia. In a short while, I'm going to be joined by Dr. Paul Zulu, an infectious diseases expert who is going to help us understand the gravity of the COVID-19 situation as it stands today. A few days ago, we did visit one of the COVID-19 centers here in Lusaka, and we did bring you some pictures. We take you to there, and then we give you an update of what is happening today as we discuss with Dr. Paul Zulu on the other side. Virginia Chilongo fathers this report where she did, show us how COVID-19 has affected our hospitals and the country at large.
Across the fabric of society. No one is safe until we are all safe. 61 is the highest we've recorded. And as we've said before, this is not just a statistic, there are faces behind these numbers. So the question we need to be asking ourselves is, at individual level, what am I doing to preserve life, to protect life? This is not about government alone. You and me, we are part of government. So what can we do as a collective? Continuing at this pace, another 2 weeks, we may be reporting 200 people in a day dead from a disease we can prevent. This is a day we ask Zambians again to reflect. It's not about waiting for the police to come and ask you to mask up in a minibus. It's your moral obligation to do so. When you are in a minibus, you have not masked up. Not only are you putting your life at danger, but that of others in the minibus, in the taxi, but more importantly, your family members at home, your workmates, among others. So this is a moral obligation. And we hope people are not looking forward to the police to come and coerce them to mask up, to adhere to the public health measures, because it's beyond that. It's a moral issue. It's a human rights issue. Sitting with someone in a bus, you are not masked up. It's a moral issue. 61 deaths in the last 24 hours. Time to reflect and do things differently at individual level, family level, institutional level, and indeed community level. When you look at the people we've lost in the last 24 hours, the breakdown is as follows. Lusaka, 20. Copperbelt, 12. Southern, 12. Eastern, 8. Western, 3. Central, 2. Northern, we lost 2 people. Wapula, 1. Northwestern, 1. As you can see, all our provinces, except Muchinga, reported deaths in the last 24 hours. Again, showing that COVID-19 spread.
That is the update on the COVID-19 situation as things stand today. 61 new deaths recorded in the past 24 hours. I'll be bringing you pictures of what is happening in our hospitals today. But before I get there, allow me to introduce tonight's guest, Dr. Paul Zulu. Doc, good evening and welcome to this special interview.
Good evening, and good evening, viewers.
All right. Doc, I would like to start this conversation by thanking you and the many other health workers that are trying, by all means, in this very difficult period to keep us alive.
Thank you very much. We're all just trying to play our little part in the whole bigger picture.
Mm-hmm. Doctor, can you give us a situation update as of today? How are things in our hospitals, and as the country at large, how is the COVID-19 situation looking like?
So I think part of it you've already mentioned in part of the series that you mentioned before this. We do have high numbers in most of our facilities across the country. As of today, mentioned by the Permanent Secretary on the brief, we have over 1,200 patients in the various facilities around the country. And on top of that, you have quite a significant number that are requiring oxygen. These are numbers that we have not seen before, quite unprecedented. Of course, in addition to all that, you have the high mortalities that we've been seeing of late. The past, I would say, 7 days, we've been having almost over 50 deaths every day. And I'll use the words already mentioned. There is a face to each of those deaths. It's not just numbers, statistics that we're mentioning. That's someone's father, mother, brother, or sister, colleague from work. And right now, we've reached a point where almost everyone has someone in their inner circle, either friends or relatives, that has succumbed to COVID. So when you look at the sheer numbers on the ground, it is something that is quite frightening, something that should cause alarm and concern. So it's not that we want to scare you, but it's also to just tell you that what's happening on the ground is real, and it's something that we seriously need to look at and see how we could work as a team, each one playing their part in trying to reduce the transmission in the country.
Is this statement exaggerated when I say that coffin makers are overwhelmed at the moment? Mortuaries are piling up across the country, and also that funeral parlors equally are just overwhelmed.
I wouldn't necessarily say it's an exaggeration. We have been seeing numbers that are slightly above what we usually see in terms of mortalities. And that's something, of course, that should be of concern. I haven't gone around the funeral parlors, so maybe not aware
We have.
how bad it is there. But from the sheer numbers we see in the facilities, there is a slight bump upwards. And if you look at the facilities themselves, it's without doubt we've seen the numbers go up. Just a month ago, I would be reporting 1 or 2 cases in terms of mortalities per day. That's countrywide. We look at all the facilities admitting companies, patients, the whole country, and we'll be talking about 1 death or 2 deaths, and some days no deaths. Now we are looking on a daily basis, over 40 people being dying in the various facilities. And it's not just Lusaka. You heard the Permanent Secretary mention this morning, you have patients dying basically in all the provinces and at various level facilities, and private hospitals, public hospitals, ordinary health centers that, like in Lusaka, you're looking at centers like Chilenje, Kanyama, Chipata, all those having deaths related to COVID in those facilities. We weren't seeing that before. All these people, usually when we talk of a COVID death, we would be talking of Levy or UTH. But now we are seeing these mortalities happening in facilities we weren't even talking about before. So definitely we do see a steep rise in mortalities.
Like you've rightly put it, we have seen deaths recorded from all parts of the country, and today only Muchinga province was spared without recording any death. Doc, I want to play this picture because with the permission of the Ministry of Health, we were taken deep into these hospitals and were given a view of what is pertaining. I know we have to discuss hope and the positives, but I want us to paint the exact picture of what is going on in the hospitals, as you have rightly started by showing this picture. Then on the other side, we'll continue with this conversation.
Since the beginning of the COVID-19 third wave in Zambia, numbers have been surging at an all-time high. This has led to the strict enforcement of the COVID-19 preventive guidelines, including the suspension of political rallies. The Ministry of Health has been announcing alarming statistics on a daily basis. However, COVID-19 still remains a hoax to many Zambians. A number of people spoken to in the streets and compounds of Lusaka say COVID-19 is fake or that it is only targeting those of high status in society. The Muvi TV news crew was granted access into the University Teaching Hospital's COVID-19 wards and the Levi Mwanawasa University Teaching Hospital COVID-19 Intensive Care Unit to get a glimpse of how serious the situation is. The unit is currently at full capacity with 10 patients, while the rest are on the waiting list to enter the ICU. The entire isolation center has 113 patients, with 17 new admissions in the last 24 hours. Dr. Brighton Sokololo is the head of clinical care at Levi Mwanawasa University Teaching Hospital.
So our patients are quite sick. The patients are referred here from the different government institutions and the private institutions, and this mostly is due to the need for oxygen. For ICU, it's overstretched. At almost any time, it's full to capacity, and we have patients waiting to go to ICU. So that's how bad the situation is. Our patients are quite sick, and this third wave seems to be even worse than the first and second wave, because we are receiving very sick patients.
UTH head of clinical care, Dr. Mwila Lupasha, says the institution's oxygen supply has been stretched.
The virus, it is affecting mostly the respiratory system. So with little oxygen, the situation gets a bit complicated. So that is the issue with oxygen. With oxygen, the complications will go a little bit up.
With permission granted, 46-year-old Kainde Chulu spoke to the Muvi TV news crew. Chulu has a word of caution to those who still believe that COVID-19 is not real.
The disease is there. It is there. You just have to get serious with it. Otherwise, it is there. Yeah. Everything was just okay for me, like in terms of treatment. It's perfectly well. That's what I attended to. That I cannot complain.
In the last 24 hours, 16 patients have died from COVID-19. And if that doesn't send a shiver down the spine of many Zambians.
All right, so that picture was as of a few days ago, and today 61 patients have died across the country. 61 people have died across the country due to COVID-19. Now, Doc, a lot of questions have been posed in this country with regards to the COVID-19 situation. Is there hope?
So definitely there is hope, and this will only be achievable if we work as a team. Like any other disease, mankind has conquered. We've worked together, come up with strategies, and rose above all these problems. Same thing with COVID. It's something that is not without solutions. It's a disease that we know that we have some measures that would work currently if we worked together as a team. And there are a number of those things we can do, whether at individual level, community level, national level. And there are so many things I know a lot of people are doing, but there is way more that we could do together to achieve that. So hope is definitely there. We just need to team together to achieve this.
Despite the mantra, the masking up, the washing of hands, the social distancing, and the many other preventive measures that we have been guided to follow, there has been questions as to what else can I do, especially if I feel sick. Is there any specific medication that is being given in these hospitals to people that have COVID-19. We have seen other people self-medicate. Can you just tell us the pros and the cons of this particular situation?
So I love that you started with the 5 golden rules, and indeed they do work. At least they go a long way in helping reduce transmission. So of course, the making sure you're wearing a mask every time you're in public, the hand sanitizing, carry sanitizer or wash hands regularly, all those are very important. One of the key golden rules is whenever you feel any symptoms, that you test early, and of course you seek medical help. Before I get to seeking medical help, let's talk a little bit about home remedies. So a lot of remedies are helpful. I know a lot of people talk about various teas, herbal medications, and those go a long way. But remember that all these are just supplementary treatment. None of them are treatment for COVID or work as prevention for COVID. And that's why as a country, we haven't really taken the route of putting out there something that will say, drink vitamin C or zinc or any of these things. No, we would want you to seek some help if you are not feeling well, especially if you are not able to breathe well. Of course, there are some key medications that will not really do any harm and are quite helpful most times, and those are the ones I've mentioned, things like zinc and vitamin C. But really things like antibiotics, we do not give an open prescription for everyone to just go and buy these antibiotics over the counter. They have implications for the individual depending on what comorbidities, meaning other diseases that you have. You may have contraindications to certain drugs, and we just don't want people to buy things over the counter. And sometimes you may be on certain other medications that could interact with the meds that you're on. So we try to advise as much as possible to try and seek medical help at the various levels. We have people trained, well-trained, the nursing staff. You could seek help from them. They'll guide after a quick assessment. They can guide on what things you probably could take at the level of sickness you are at. We have a lot of other medical staff like clinical officers, other health practitioners, the clinicians themselves, the doctors, that you could seek. I know we are overwhelmed in the facilities, so we are trying at the same time to make it easier for you to find something you can take over the counter. And over-the-counter meds like cough syrups and the like are helpful, but we don't want you to continue doing that without trying to seek some help. Help is available, and this can be sought either by going to your nearest health facility. The way the system is overwhelmed, of course, the issue of calling in, we used to do that before, but it may take a little long, and if someone really is breathless or you feel they're somewhere on a danger point, we recommend go to your nearest facility and we will assist you from there.
Now, Doc, like you have rightly put it, there are people that have been, taking over-the-counter medications, and what are the dangers of taking these medications to one's health?
Yeah, so there are some things that may outrightly not be harmful there and then, and there are some that may be. And so everything needs to be taken with caution. Like I've said, things like vitamins, cough syrup, most of them mostly are harmless, can be bought over the counter, but there's for symptomatic relief. But even those, if not taken rightly, for example, something as simple as a cough syrup, just because you're coughing excessively and you overdose on the cough syrup, that could bring other problems. So we want you to take them with caution and seek help as you do so. And there are other supplements, even the vitamins themselves and the like, that could aggravate or say worsen your pre-existing conditions. For example, it could be hypertensive and take some over-the-counter medication that could push your blood pressure further up and cause more problems. Or you could be diabetic and in trying to self-prescribe. I know people have heard all sorts of things. For example, people have heard that steroids do help, but they do help in a certain group of people. If you went and bought steroids over the counter and started taking them, they may help in a few, but for most, if you take them wrongly, for example, you're diabetic, they could actually worsen your overall conditions, and then the diabetes could become a larger problem for you. So taking over-the-counter drugs without the right direction or supervision of a health professional may cause problems. And for that reason, we strongly recommend that for most of these medicines, seek help or at least advise on what you could and could not take. I'm sure at some point we did issue a health advisory from the Ministry of Health that just spoke to the various herbal medication and over-the-counter drugs. Like I said, some which you could try, but mostly we take all those with caution. Even something as simple as ginger, or if not taken rightly, could cause problems. People have been taking eucalyptus oil and all other remedies. But if you take some of these things and without knowing, say you have an allergy to them, could cause larger problems for you. So always seek some help as you try to use this over the counter. They are helpful for temporary relief, but in the long term, especially if you're not breathing well, do seek medical help.
Like you said, there are some patients that are diabetic and probably do have other ailments. I have a follower of Muvi Television that has written to me to say, a relative of theirs was given azithromycin, and they are diabetic, and then they just discovered that could pose a danger to the patient.
Yeah, so we have all sorts of stories, examples from patients that we see on the wards. Certain medications could actually, like I said, worsen your diabetes. Others could worsen your hypertension. Different meds. There are people who have heart conditions where even a drug like azithromycin could actually cause more problems. Then remember, azithromycin is an antibiotic that you may let for other bacterial infections. And if not taken rightly right now, could cause bigger problems for you later on. The day you actually need it for something, you may find it's not working properly or you have developed resistance to it. So those are some of the problems.
Doc, I'll bring you to this side of this conversation. We know there are vaccines, and currently Zambia had stopped vaccines or vaccinating its population. But we also are aware that there are about 4.4 million vaccines and hundreds of thousands of others that are on the way coming. What is the benefit of someone, to get this vaccine for COVID-19?
So vaccination is one of the key important strategies that we look at. So it's important for you on an individual basis. Apart from the golden rules we've talked about, sanitizing, social distancing or physical distancing, masking, vaccination is also an important way of preventing COVID. So vaccines do reduce your chances of getting COVID. We're not saying that they absolutely cut that risk to zero. You could get a vaccine and still get the disease eventually. But one of the key things, apart from reducing your chances of getting COVID, they also reduce your risk of getting severe disease that may require hospitalization or critical care for that fact. So there are more benefits to getting these vaccines. At a larger community level, there's something we usually refer to as herd immunity, meaning, excuse me, when a certain number of people have received the vaccine, usually over 70–80% of the population, that then confers some relative immunity to those that have not received the vaccine. So we try as many people as possible to take the vaccine. That will help protect even those that have not received the vaccine. Unfortunately, looking at the numbers we have so far, it means we have only probably given close to 2%, 3% of the eligible population that needs to get the vaccine. Remember, we said we needed to vaccinate at least about 8 million people that are eligible for that. And right now, we're only talking about 220,000 doses that we had received, and we are not even at that number. So these are coming, and they are very important, and we would urge, once your time to receive the vaccine comes, do step up and take the vaccine. It is very important for you as an individual, and it's very important for a community around you, that when you receive your vaccine, it protects you. And when more of you in your community get that vaccine, it protects the community as a whole. So when you're called upon to come and receive the vaccine, and I know this will be staggered, priority, of course, will be healthcare workers and other frontline workers, so that we can protect those that are helping you, caring for you. But after that, and as we were already doing, we are prioritizing those that have high-risk conditions. So if you're diabetic, you're hypertensive, you're a bit overweight or obese, it puts you at risk of getting severe disease and eventually being dying from COVID. So I want to prioritize those populations that when we call upon you to come, please do come, because this will be a lifesaver for you.
0764250055 is the number to call if you'd like to get to this conversation and ask Dr. Zulu a question concerning the topic that we're discussing today. That is the COVID-19 status or situation update in our country, Zambia. 0764250055 is the number to call. Now, Doc, a lot of people have adapted to the 5 golden rules, or to the golden rules, and trying by all means to protect themselves and their families by masking up and keeping the social distance. What can the people do further to stop this virus from spreading?
So the masking, very important. That's something, wear your mask. And when we talk about mask, one of the key things we want to talk about is wear your mask correctly. The mask should not just cover the mouth, but cover the nose as well. That's why I see a lot of people where the mask is just covering the mouth, not covering their nose, and they're having a conversation. Essentially, all you're doing is you've put a mask on your face, but it's not covering the essential parts that it needs to cover. So that's one of the things. But apart from the other things, one of the golden rules is avoiding crowded places. And that's something we all, I know, and that's why sometimes you hear us changing from social distancing and talking more about physical distancing. We are social beings, and we always want to mingle in one way or another. And because of our circle of trust, sometimes you say, I'm not going to go to a congregate setting like church or the club or the bar, but you still do end up having a braai in your house with a neighbor or two. It may seem like a smaller population, but these are people then that are around you that most times you do not know where they have been. And sometimes it's those smaller settings that will also even cause clusters of infection. You may just be 10 people having a small party at home, but you can start a fire just with that smaller group. So try and minimize even those smaller groups. You can have a meeting with neighbors, friends, via Skype, Zoom, and many other teleconferencing platforms, and still have some social way of interaction. And it's those smaller things that we want us to do more. There are a lot of things I know, for example, funerals, and a lot of calls have been coming up. We need to ban funerals and the like. Yes, we know we have our culture, and we all want to send our loved ones in the right way, but we can do that safely with having smaller funerals, and we could remember them in the days coming when the number of cases has gone down. So there are a lot of these smaller things that we could do, not just at a personal level, but at a community level, to try and curb the cases that we're seeing.
All right. Allow me, Doc, to now allow those phone calls to come through. I've missed quite a number. I needed to allow you, finish explaining. 0764 250055 is the number that you are calling. I am joined by Dr. Paul Zulu, and we are discussing the COVID-19 situation in Zambia. He is an infectious diseases specialist who's helping us understand the level or the extent of the COVID-19 situation in Zambia. Hello, good evening.
Good evening, thank you.
How are you, sir? Very fine, thank you. Where are you calling us from, and what is your name?
This is Chinyama calling from Dora.
Mr. Chinyama, please go ahead.
Yes, I want to know the issue of streaming. Is it viable? And if it is viable, what materials should be put there? Then the second question is the issue of ginger and the likes. Are they help?
All right.
Thank you.
Thank you very much, Mr. Chinyama. Doc, I'll write these questions down for you. Is steaming viable, and is ginger? If steaming is viable, what are the things that people need to use for them to steam when they are trying to rid of COVID-19, or when trying to prepare themselves to prevent COVID-19 from attacking them? Is a question coming from Ndola, from Mr. Chinyama. Maybe you can take that question and also respond to the question on ginger. I know you did talk about it earlier, but for those that have not heard.
Yeah, I'll try to be quick and really brief so that I allow more questions. So I'll start first with the steaming. The Bemba word, I think, kukufukitira. I'm not Bemba, so sometimes I may mix the word.
That is correct.
It can be helpful, and I think long in memorial we have been using it. But it needs to be done with caution. Like I said, we have seen people come in with burns just from trying to do that, if not done rightly, especially children. So it needs to be done carefully. And also the things that we add in, you may have to just check that it's not something that you may be allergic to, or something that could cause further breathing irritation. Like I said, there are people who will tell you add in a bit of, say, eucalyptus or something, and you may be one person who reacts to that. So just be careful what you put in. And I know a lot of people put in different things, including bath salts and such things. So careful what you put in, and always be cautious. Heat in itself, if you are hypertensive, can push your BP up. So if you go in a sauna environment where it's really hot, it could actually push your BP up and cause more problems. Other herbal things like the ginger, lemon, turmeric, and many others can be helpful, but need to be taken in moderation. And like I said, can be helpful, and not everything works for everyone. And as you take them, seek medical help, especially if you're on other medications, because even these so-called traditional or herbal remedies can actually react with the medications you're currently taking. They could have interactions. So just seek some medical clarification if you're trying to use one of those. I hope that goes a long way in helping explain that to you from Dola.
From Dola. There's also a query on, when you say steaming, what is the right procedure? How do you do the steaming?
Yeah, so ideally you're supposed to put water in a basin. Most people prefer to use where you just put some hot water in a basin that has some steam coming out. You could just use the pure steam without adding anything. Others may add any other additive in there. The whole point is then to, most times, cover the top part of your head and try to breathe in the steam, which should help then open up your airways. And that's why I said that usually is the way you do it. Others may, if you have a smaller room that can easily be filled up with steam, may just put something, either a brazier or something that will then put up steam in the rooms. Then they sit in there to try and breathe up and open the airways. So even that can be helpful. But like I said, with caution, because if you lock up yourself in a room that is hot, And for example, you're hypertensive, you could push your BP up. If you're using a basin closer to your chest, as you bend over to try and breathe in, you could tip the bowl or something, and that could then either cause burns on your skin from the hot water, or if you're too close to the steam. And that's why most times you try maybe your hand slightly over and just feel how hot it is. Because if you put your face too close to the steam, you might end up with burns on your face. And sometimes people even have very deep burns, not just superficial burns, but deep burns from that. And that's why we say do it with caution, and hopefully someone who's tried it before that can guide you through with it.
All right. 0764250055 is the number that you are calling to get through to studio and ask that question that you have concerning the COVID-19. We are joined in studio by Dr. Paul Zulu, who is an infectious diseases specialist and is helping us understand, what we need to do with regards the fight against COVID-19 at individual basis. It's very important that all of us do follow the, golden rules: mask up, keep the social distance, sanitize, avoid social gatherings, and stay home is the biggest advice that we are giving. We are told that the virus does not move, but that people move the virus. Hello, good evening. Hello, good evening. Hello, Mlibwanji. Mkwai mwawomben mai. Bweshanko volume TV. Oh, sorry. When you are calling, kindly reduce the volume from your TV. Kamletu mafoni. Bweshanko volume TV. Pakwe bati tumfwane wino. Gati mutu mafoni. Mufuni kama bwenzako volume TV kwanu. So that there's no feedback. Ngati mufuna muzimverere ku TV, kamalefo kuyumfa ku TV, chalashu papa kutifwe kuno tumiyumfwe. So making sure nga mletu mafoni TV nishinambwesha ko volume pakwe bati tumfwane wino. 0764250055 is the number that you are calling, and we're trying to find out from you what is your biggest question on COVID-19. Dr. Zulu is here to answer some of those questions that you have. 61 people as of the last 24 hours have died due to COVID-19. Let us all make sure that we, follow the laid down guidelines on COVID-19 prevention, the 5 golden rules. Hello? Hello, Mlishani.
Hello, Mawombashani Mkwai.
Mkwai Mawombashani. Tulanda na banani mule tumina kwisa.
Mulanda na ba Catherine Kiselenge.
Ba Catherine landeni question mukwete.
Depo okukushago kai mulanda ti corona lo nomba ya fula pesa ngere tesho mare tunga wachare wobechi.
Okay. A question for much quarter. Inyereti abakuchipatala balandira tinyereti shire bomba lorere nalayo aba doctor basukedi pusho but kufyonjishibe balandira tinyereti shire bomba lelo abantu abalashiwe nyereti abalefu abanono kulinganya na kusta compare na abantu abashilala senyereti but wala mfufala ndaba doctor mwikale muleta mba TV. All right. So, Doc, that's the question from Catherine in Serenge, who is saying, why we're being told that the COVID-19 numbers are on the rise, but why is it that even after vaccinating people are still dying? But before you answer that one, Doc, allow me to just bring in another question, and then you answer them as a whole. Hello? Hello? Hello?
Hello, yes. Good evening.
Good evening, thank you, sir. How are you?
Hello?
Hello, good evening.
Hello.
Kindly move away from your TV and then go ahead by telling us your name.
How are you, sir? Hello?
Yes, sir. What is your name and where are you calling from?
My name is Martin Siego. I'm calling from Namara, sir.
All right, Martin, please go ahead with your contribution.
Now, I want the doctor to clarify certain important facts and issues.
Sure.
Yes, because we know that before a drug is installed to give the public, it takes up a minimum of about 14 years.
A minimum
You
of?
have to go in animal trials, then finally selected group trials, and then finally it comes to the people with a lot of monitoring.
Sure.
Now, these vaccines which they are using, they are just about 3 years old. Is the doctor going to comment something about the short-term and long-term side effects of the same drug before actually Zambians can actually be affected maybe 10 years from now?
All right.
Yes.
Thank you very much, Martin, for that contribution.
Okay.
All right. Doc, I'll allow you answer these questions from Catherine as well as from Martin.
So, Catherine and Martin, thanks for the questions. I'll clarify a little further, I think, on Martin's question.
Sure.
But I'll start with Catherine. So, the vaccine does work. Like I said, it reduces severity of disease should you get the disease after the vaccine, and also your chances of being sick enough to be hospitalized and end up critical. So there will be a few exceptions to the rule, but majority will have milder disease. The reason we are seeing high numbers right now is several reasons. In part, almost all the people we're looking at never got fully vaccinated. Most of us got only one dose. I only got my second dose yesterday. So majority of us have not been fully vaccinated. That's the first thing. Secondly, the vaccine does not work on its own without the other measures being put in play as well. So you still need to adhere to the 5 golden rules in part. Then thirdly, there was also the thing that I mentioned about herd immunity, meaning the more people that are vaccinated, the more it protects the community around you. Remember, the doses we got were very few. Only less than 200,000 people were vaccinated. Well, slightly over anyway. When we were supposed to look at a population of over 8 million that were eligible. So what we did was basically a drop in the ocean. And like we said, that drop in the ocean was basically meant to protect the people that will be working, taking care of you. As we increase the number of people vaccinated, we should see a very steep drop in people getting severely ill and probably dying. If you remember when we started, the focus was mostly the healthcare workers and other frontline workers, those that are in the forefront, controlling things in the COVID response, just to protect them so that they can continue doing their job, to take care of the rest of us while we wait for the vaccine. Unfortunately, we have seen circumstances as yesterday where we lost one of our gallant soldiers, a young doctor. We also lost a nurse that have been working in the fight. The whole aim was to prevent such people from dying so that they can continue saving more lives. So that's one of the reasons we have that focus. How about the vaccine itself? Does it have any side effects? So definitely, as any medicine, vaccines will have some side effects. The common side effects are your usual pain on the injection site, headache. Some people may experience a bit of fever and chills, but these are usually short-lasting. For most people, just a couple of hours or a couple of days and it goes. I know a few individuals where it's gone on for slightly over a week, but that's in rare circumstances. Then, of course, there are those rare circumstances where someone has an allergy to vaccines, for example. We have seen very few of those. And, of course, there's the issue of the clots that we're hearing about. That's something we have not really been seeing. And when you put it in perspective, the numbers, you realize that your risk of developing clots from COVID itself is way higher than you taking the vaccine. If you look at the vaccine, you have the risk of about 4 or 5 people out of 1 million people get vaccinated, getting a clot. While if you look at COVID itself, over 160,000 of a million patients who get COVID will develop clots. So the risk of you developing a clot from COVID versus the vaccine is disproportionately large. You're more likely going to get clots from COVID, and I think those are the reports when we hear post-mortem reports of people that have died from COVID. Such are the findings that we have at times. So you are safer off getting the vaccines. Will there be any long-term effects from the vaccine? As with any drug, there may be, but that's why we have Zambia working very hard on something we call post-marketing surveillance, and we do that for every drug, meaning once a drug is on the market, we allow people to submit reports of any reactions that they may have, and that's important to report these because that will inform us of maybe any side effects that could have been missed while the drug was still on trial. So even something like Panadol, we still report. There will be that rare person who developed a rash from Panadol, and we document so that we have it on record that it's possible to get rash from Panadol, even when the majority don't. So even with vaccines, we are still gathering data to look at any possible side effects that may come up in the future. But yeah, these vaccines went through all the trials, looking at safety and making sure they work effectively before they were released on the market.
Doc, is there a specific vaccine that is recommended? We know there's the Sinopharm, there's the AstraZeneca, and there's the Johnson & Johnson as the vaccines that Zambia, is going to be using.
So we have several vaccines that have been, I'll use the word approved for use in the country. One of them is the AstraZeneca, which we're already giving. The Johnson & Johnson, Moderna, Pfizer, Sinopharm, all those have been approved for use in Zambia. But as a country, what we have received so far is the AstraZeneca. That's what we are giving. And we have, like you mentioned, about 4 million doses that will be staggered, but will be coming into the country of Johnson & Johnson. And as more vaccines are produced and more are approved, we will have access to those. But right now, what we're getting access to is the ones that we have mentioned. But even the others are approved, and either private companies or others that are able to bring them in, of course, with collaboration with the Ministry of Health, those can be imported into the country and still will be given to the population. So, for example, some private hospitals are working on importing vaccines, for example, like Pfizer, through the Ministry of Health. They will be allowed to do so, and those that may have a preference, for example, of one vaccine over another at some point when those are available may have access to that. But what is available in the public sector right now is the AstraZeneca, and soon we'll have the Johnson & Johnson available to us as well.
Doc, we have about 5 minutes before we wind up. I'll allow one more caller to come through and give us a question or any query that they have concerning the COVID-19 situation in this country. But Doc, there's one of the people that are following us, one of our viewers following us via our online platform, in the name Brands Yakowa, who says, can chewing garlic be a substitute for steaming?
Yeah, so like I said, most of these garlic, turmeric can be quite helpful. But like I said, they are neither prevention nor treatment. They are mostly used for symptomatic relief. And most of them, if you, even ordinary flus, when you're developing a flu, chewing some garlic may usually offer some relief and shorten the duration of the symptoms you may feel. Those that have nasal congestion, there are several things you can do. Like kids, usually we know just a bit of saline drops in the nose kind of open up your nose. So those things can be helpful as well. So garlic, not really a substitute, but very helpful for most viral bacterial infections. So something that you could take as something to help make you feel better. And just to add on to the vaccines, the Bex vaccine is one vaccine that you have injected yourself with. So regardless of the type of vaccine, do get a vaccine, whichever one is available.
Doc, as we wind up, I'd like to get your concluding remarks with regards, the measures that, just a reminder to the viewers, the measures that we need to take as a citizenry, but also as you know, at individual level?
So at national level, there will be a lot of things that we will put in place. I will not speak to those. I will speak to the things we can do as individuals.
Yes.
Let's do the simple stuff. It seems to be hard right now. Things like masking up. Let's all mask up. Whenever we are in public, think about your neighbor, think about the person next to you. It was interesting to see that man who gave us a permission to film him, who said COVID is real, and you could see he was having trouble even talking. So let's mask up. Let's make sure the simple things like carrying some sanitizer on you that you can use, hand sanitizer for your hands. Let's do that. Let's avoid the crowding. And as much as possible, let's stay at home. There are several things that we can do at home and still have fun with colleagues from the comfort of our home. So let's do that to lessen the burden on the people that are working in the facilities and reduce the number of deaths that we're seeing.
Doc, we would like to appreciate you for having time to spare and share with us on these you know, very important matters, and we wish you and your team, everyone in the health sector that is at the forefront battling COVID-19, all the best.
Thank you very much, and thank you to all the viewers. Stay safe.
Right, so that was Dr. Paul Zulu, and we were discussing the COVID-19 situation in this country, and we'd like to just re-emphasize that you need to follow the golden rules: mask up, sanitize, wash your hands with soap, regular times, but also do make sure that you keep the social distance and avoid these gatherings. Stay home if possible, stay indoors. This has been a special interview. My name is Liz Nkonjara. Pleasant viewing.